Okay. Time for video. What I said I would, what I said I would do. The previous week, I did the video a day. I did like one for every day of the 10-day writing challenge or course. That was for the July the 20th exam, and I thought I'd have a few days off. Not so many people were watching the last videos, however, on YouTube, which was kind of strange. The first one, which was on July the 10th, got over 1,000 views, about 1,500 views, which was quite encouraging. However, over the course of the 10 days, views were going down. The last one, they got about 300 views or something. So again, that was not very encouraging. However, what I'm going to do now, and for the foreseeable future, I'm going to ask people to copy and paste their writings into Google Docs. This is going to make it easier for me, essentially. You can see we have some letters here. Now, there's a couple of who I call repeat offenders. I'm going to include them today, but in future, as I mentioned before, I'm not going to be assessing more than one letter each, because that's just not on. If you think I'm going to do that, you're basically taking the piss, and I'm not going to do it. And I can't see any reason why I should. That's what people pay me for. They send me a letter, I correct it, I send it back, they take note of the changes, and etc. If I were to simply correct every letter that everybody sends, and there are some people who send letter after letter, that's essentially a free correction service. Why would I do that? Why do you think I would actually? Why do you think that I would? And what possible benefit would there be to me in doing this? So, from this point on, only one each, and we will see. So, I'm going to save the changes, put this video on YouTube a bit later on. So, I'm just going to look at the grammar, vocab, general cohesion, appearance. I don't have the case notes. I'm not going to compare them because there might be issues of copyright, and I don't want to get involved in that again. That happened before. So, and also as I've said, if you write your letter correctly, I shouldn't need the case notes. It should be clear from what you write, what you want me to do, and the layout and chronology should be clear also. So let's let's have a look. Writing to refer Mrs. Bowen, whose signs and symptoms are suggestive of polycystic ovary syndrome, for your thorough assessment and management. Okay, that's good. Don't forget auxiliary verbs. Be, am, is, was, were. Initially, Mrs. Bowen attended to my clinic. Well, he simply attended, presented on the 28th of the complaints of regular with the complaints. Is that a singular or plural complaint? Irregular menstruation, that's the main complaint, so I would make it a singular verb. Sorry, singular noun, which is associated with frequent. Now, right, you've got to be careful here because you're using a relative pronoun, which is associated with. So this could be too general, irregular menstruation, which is associated. That could imply like a more general association. But here, it's a particular association with the complaint of irregular menstruation. So we don't need which is, simply with the complaint of irregular menstruation associated with frequent dysmenorrhea. In addition, she's been suffering from acne for 3 months. Okay, I don't know if that's pertinent or not, but we don't need this to be a separate sentence. You can simply use a comma. Therefore, down to 35 to 2 milligrams was prescribed. Now you can, sorry, sorry. Use of passive. Now you've got to be careful here. You know, you have to show a range of structure that is true. But if you performed some action, now right, one reason why OET, etc., wants you to make use of passive is when the action is more important than the individual. Okay, so, but if you're the one performing the action, now use of passive, like say you were a doctor in a clinic or you were a doctor in a hospital and somebody else performed some action, like the patient was admitted, you didn't admit her, him, it. So passive would work there, you know, because you didn't perform the action of admitting the patient. So you could use passive there. On the 28th, Mrs. Jones was admitted. Okay, good, because we don't know who admitted her. So you can use passive there. But if you're talking about, you know, the patient is sitting right in front of you in the same room, you prescribed, therefore I prescribed, etc. So passive's useful, but only when appropriate. And that's the key. All of these different things, they are, you know, to be included only when appropriate. Okay. Complaints of regular menstruation. Okay. 1 year later, Miss Bowen, is it Mrs. or Miss? You've got to watch your pronouns. If you mix them up, that will cost you. Mrs. Bowen, we attended with a complaint or B complaint of worsening acne problem for which was treated. For which was treated? Which? So, Mrs. Bowen, well, I don't know, is it? Yeah. Mrs. Bowen reattended complaining of a worsening acne problem, which was treated with antibiotherapy. In spite of treatment, there was no change in the problem or in her problem or her condition. Now, we don't have to specifically say what the condition was because acne, and there's only one, so we can refer back to it without using acne again. So in spite of treatment, there was no change in her condition, and she also suffered, or right now, because you've got to be careful with your tenses here, okay? So she reattended a year later. It's simple past, okay. There was no change in her condition, and she also suffered. Now, I would be tempted to make it past continuous because it was an ongoing activity at the same time. Okay, so instead of simple past, so she reattended with one complaint of acne and round at the same time, ongoing, so you can use past continuous. She also suffered from diarrhea. Diarrhea, how do you spell it? I don't know if you have an A, I think that's right. Then you're going to go down this, put a comma, and a sore tongue. Now, the reason why I put a comma, when you have a list and it's not the same kind of thing, you can, you know, so that's from a lass, that's from a different part, and a sore tongue, which is not related. So I would put a comma and because a sore tongue is a noun, it can be counted, so I put an article there. Therefore, she was referred to a dermatologist, etc. On review today, she was depressed because of difficulty in conceiving, along with right now. So you need to be careful here because you've got your main verb here, okay? And she was depressed because of, depressed along with. So the implication here is that this is causing depression, and I'm not sure if that's the case. Along with means besides. So on review today, so to make this better, you could say something like, on review today, she attended or presented complaining of difficulty in conceiving, along with amenorrhea and weight gain, which made her depressed. Because if you've got your main verb here, it implies that everything, and I don't know if that's true, everything that comes after is she's depressed because of conceiving, because of a weight gain. That could be true, but we need to be clear. Please note she is married. I think I remember this one. I think she came with a husband, and there were some other things, which we don't seem to have here. Please note she is married and has ceased since January 2013. Well, if she did it in January 2013, that's a specific period. So we wouldn't use present perfect. We don't actually need it, you know. She actually is married and ceased or stopped OCE treatment in January. Okay. The blood tests, what blood tests? Don't drop in new information. What blood tests? Did you arrange for some tests? It doesn't say. Simply, oh, the blood tests revealed. So in terms of structure, right, of a paragraph or a visit, usually there are three components. The patient came, the patient said, what you found, what you did. So the blood tests, when did you organize these tests? Did you arrange them? Because it says on review today. So she came on the 28th, 2014. Okay, she came a year later, on review today. So when were these blood tests arranged? It just seems like it's information that's kind of dropped in. Yeah. Okay. The blood test will decrease the load. Copy of pelvic QSS will be sent to you. Okay. So what's going on here is not very clear. Okay. You need to put some dates in so we can see. Put in a date. When were the tests? So in terms of your paragraph, right? The patient came with, and they said blah blah blah, what you found, examination blah blah blah, what you did. Okay, so that's what I would do in terms of a paragraph. I ordered blood tests which revealed, but when were the tests ordered? Was it on review today? Did you do a test when she came in and she waited while you got the results, or did you order the tests the previous time? We don't actually know. It's not so clear what's been going on here. And don't use abbreviations without spelling them out first, because we don't know what it means. So you usually spell your abbreviations out first, then you can use them. Okay. So polycystic ovary syndrome. I would have put it PCOS there. Okay. What do we have here? Emma John, age 11 years old. Well, age 11, you don't have to put years old, you know, because it's not 11 weeks, is it? Or months. Writing to refer Emma, who signs and symptoms assessments the asthma treatment by excellence for further management. If you want to do it like that, you need a comma there to make it a non-defining relative clause. But I don't think we need that. I'm writing to refer Emma, whose signs and symptoms are consistent with assessors for further management. Now, okay, I will be tempted to, make it clear I'm writing to request your further management. Again, I'm not sure what you're being asked to do. I haven't seen the case notes for this. So I'm writing to request your further management, your further assessment of Emma, whose signs and symptoms are, etc. You could do it like that. Initially, Emma presented. Right, did she come? Right, so she's 11. Did she come on her own? Because if she's a kid, probably not. Usually, it's a parent, mother, and usually she's the one who does all the talking. That's what, well, that's usual practice if it's a kid, yeah? So did she come on her own? No, it's not clear. With fever, nocturnal cough, nocturnal coughing, because presumably it wasn't just a single cough. Presumably it was ongoing. Nocturnal coughing and runny nose for 2 days. So she presented for 2 days, or the conditions or her symptoms lasted for 2 days. You've got to be clear. With a 2-day history of fever, nocturnal cough. So put the time at the start. Presented with a history, with a 2-day history of blah, 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 blah. Okay. In terms of family history or her family history, please note whether or not the sister suffers from asthma. Okay. She has no known allergies. Why is this a separate sentence? Why don't you make it, in terms of family history, please note a mother and elder sister suffers from asthma and she has no known allergies. On examination, the patient was febrile, flushed, and pharynx, well, her pharynx was, if that's anything, was inflamed. It's singular, was inflamed. Chest examination was normal, but hence paracetamol was commenced along with fluids for infection. You prescribed, commenced, and you can use it, but prescribed I think is better. Hence I prescribed and blah blah blah. On the next visit, again, did she come on her own and present with similar complaints? And examination showed, if it's in the past tense, showed a faint, because faint basal wheeze or wheezing. So it's either a wheeze or wheezing if it's continuous, along with a peak expiratory rate of, so you're supposed to make grammatically complete sentences. Therefore, the patient, or you mean Emma, was diagnosed as probable, right, either diagnosed with or diagnosed as an asthmatic. So, diagnosed with probable asthma and commenced on Ventolin puffer, 2 puffs thrice daily. Reviewed back, how can you review back? You can come back, you can return for a review, but you can't review back. With improved symptoms. Additionally, what does this have to do with anything? So where's the logic there? So she reviewed back with improved symptoms. Additionally what? This is something else. Additionally means and. It's not connected to the previous sentence. Emma returned with improved symptoms. So if the symptoms were improved, why did you prescribe? And what's this advised? So you don't advise a kid to take a certain form of medication. Oh, by the way, 11-year-old girl, I advise you to go to the chemist and get this. Well, no, you prescribe. You don't advise. You can advise a patient to stop smoking. You can advise a patient to exercise more, but you can't I advise you to take these particular drugs. Well, where's she going to get them from? Don't you have to write a prescription? So advised does not work there. Okay. Furthermore, 2 months later, Emma's possessive or genitive case, Emma's condition worsened since 48 hours. How can it worsen since 48 hours? What, did it worsen within 48 hours? So I have no idea what that means in terms of time. Not clear at all. With widespread wheeze, was it one wheeze or was it a wheezing? Was it an activity in progress? Was it a single wheeze? Widespread wheezing on auscultation of expiratory flow rate and a peak expiratory flow rate of make complete grammatical sentences. Despite using a Ventolin, because you can count a nebulizer, nebulizer stat, there was minimal relief. It would be highly appreciated. By whom? By you? By her? If you could further manage this case, should there be any queries, please don't hesitate to contact me. So there's some things here are not clear. And you have to, when you are writing, you need to be as clear as possible. I shouldn't have to look at the notes. I shouldn't have to. Your letter should be clear. I want you to do this because of this history, because of this visit, because of this. The patient came, I found, I did, therefore, blah, blah, blah. There should be a logical flow to it, which we don't quite have in every paragraph here. Okay, let's have a look. I might not have time to do all of these. It's about 9. I've got 20 minutes left, so we'll see. And I did say to people, don't post more than one letter. However, I'll take a look just this once. Writing to refer Mr. Dunbar, a diabetic patient. Well, of course he's a patient. A diabetic, for continued monitoring of his blood glucose level and to provide encouragement to adhere with his medication and diet. Okay. Okay. It's a little bit long, but he's willing today to send it to his daughter. Mr. Dunbar's a diet for 2 years, which is taking metformin 500 milligrams, was encouraged. How can you encourage someone for? You can encourage somebody to do something, but you can't encourage them for. You can advise someone to, I advise you to do this. You can advise and encourage someone to do something, but you can't encourage them for a diabetic diet. So why have you got diet mentioning twice? He was advised and encouraged for a diabetic diet. He's still not complying with his diet. That doesn't make sense. That should be a separate clause with a comma, or it should be with a relative pronoun, which he's not complying with, or something. But that sentence doesn't work in terms of grammar. Furthermore, he occasionally forgot. So, did this happen once, or is it ongoing? So it shouldn't be he occasionally forgets. If it's present simple and he's doing it often, forgets. Forgot. Forgotten means that it happened in the past once. So I think if he's doing it on a regular basis, if it's a habit, a routine, then it should be present simple, because that's what we use present simple for, yeah? Forgets, eats, leaves, sleeps, etc. So that's what I would do there. And takes intermittently. Takes what intermittently? Takes it intermittently. Regarding diet, or his diet, he consumes salty, sugary, and fatty food, or foods, because it's an abstract noun, so we make it a plural. Or with excessive alcohol. Although, and why is there a comma? Although he was advised to reduce the intake of such foods and alcohol, such food and alcohol, he still remained almost. Have you kind of said that once? Shall I say, and fatty foods? That's what we've got pronouns for. so you don't have to keep repeating the same things. Them, those, this, it, that. Although that's why I changed it. These, such, those. Or although he was advised to reduce the intake of such food or those foods and alcohol, he still remained resistant and unmotivated and considered consuming them after the death of his wife last year. That's what we use pronouns for. As a result, he suffered from diabetic neuropathy, therefore is walking slower. That does not necessarily follow. Therefore means as a direct consequence of. I'm sure that's not the case. You could say such subsequently, or as a result of this, but not therefore. As a something I think to 20. Please note he's walking slow. Well, if he's got a walking stick, he's probably not walking fast, is he? His daughter was advised. So we've got some three basically disconnected pieces of information there. I'm sure that could be written a little better. So the timeline here, I'm not so right. So he's had diabetes for more than 2 years. Okay. Regarding diet, so this is ongoing. So in the past, in October, he suffered from this. Okay. And then he suffered from something else before. So so in October, he started something in June, subsequently commenced. Well, he didn't commence himself. He was commenced. His hypertension is controlled. So the chronology here, I'm not really sure what is going on. It's not very clear what the chronology is. So, there has to be a logical flow. So first thing, I want you to do this. Why I want you to do it is, if we look at this history of this event, and this event, this leads me to ask you to do this. But here it's jumping around. He's got diabetes, and it's talking about his diet. Then it's talking about his wife died. Then this happened in October. Then this happened in June. Then this is present simple is controlled. Therefore, okay. I think this needs a little more work on organization and structure of information. I think it needs a little bit more work there. It's not quite clear what is going on here. And let's see this next one. I'm writing to update you on my ongoing treatment and subsequent interventions for your patients. Okay. Well, it's usually treatment of, but interventions you usually intervene on someone's behalf. So I'm not sure what preposition. On the ongoing treatment and subsequent interventions. This is Isabel Garcia, whom you refer to as a unit on account of suspected meningitis. It should be recalled. It should. I don't know if you would use that. Miss Garcia was referred. I think that's possibly better. Now, we're talking about uses of passive. And if you read OET, E2, swoosh, etc., they say one reason to use it is when the important information, yeah. So Miss Garcia, so the important thing is Miss Garcia came to the emergency room, not that you referred her. So this would be a good instance of why we should change it from active into a passive. So Miss Garcia was referred, yeah, because that then that is better. That's good use of passive, because the important thing, the important information, the patient, comes at the beginning of the sentence. Miss Garcia was referred on the 23rd. A 1 week history of headaches, blah, blah, blah. On the examination, she was able to perform the chin to chest test. Whereas petechial hemorrhages on the legs, albeit being aphoretic, following we're finding some investigations were odd. I know you keep using this, but in terms of English, right? Investigations, we would probably say tests. Investigators investigate. Oh, 10 minutes left. Turn that off. Some investigations were ordered with the results revealing elevated white blood cells in plasma and CSF. I would try and spell things out, try and avoid your abbreviations, with a preponderance of polymorphonuclear cells. While we iterate the report of a lumbar puncture maximum examination is currently being managed in case of bacteria. Isn't it bacterial as a adjective? Multiple symptoms, bacteria change. Okay, yeah. Yeah, that's not bad, not bad. All I would say is just make this, for paragraph 2, make it passive, because the important information needs to be at the beginning of the sentence. So that would work well, I think. Okay, and that's pretty good. Somebody's writing on the screen. Don't do it. Don't know whose this is. Miss Hall, age 45 or age 45 years. Now, if it's years, it should be years old. I'll just say age 45. I am. I'm writing to refer Miss Hall, who presented with signs of box picture. For further investigation, definitive diagnosis. You can make that a non-defining relative clause by using a couple of commas there. Regarding a social past medical history, she was overweight, consumes lots of coffee, takes aspirin, and with a positive history, has a positive history of intake of herbal concoction. A positive history of herbal concoction. If you have to use that, herbal concoction intake, not intake of herbal concoction. A positive history of herbal concoctions. I'm not quite sure what those are. Intake. She equal to what? Equal to what? Wouldn't use that. So it's from dyspepsia in 2012. Additionally, not equally. Today, she presented at my surgery with complaints of dysphagia to solids of 2 weeks duration, tract infection, over-counter Chinese herbal mixture. On examination, there was epigastric tenderness with pain, readiness to the back at level of filling. There's no sensation of lump or obvious. And no sensation of lump or a lump, nor obvious anxiety was noted. Okay. Based on my assessment, I made a provisional diagnosis of esophageal deficit, and advised her to, you don't advise on, advised her to reduce her coffee and alcohol intake. In consideration of the above, don't forget your I am referring her to you for further assessment and conclusive diagnosis. Should you need further clarifications, do not hesitate to contact me. Okie doke. Not bad. Let's see. And who's been writing on this? Where are we? Annotate. Where's the eraser? Oh, there we go. Get that off. Okay. I'm writing to refer Mrs. Kaze, whose features are suggestive of a ductal carcinoma of the left breast for further assessment and management. Ms. Kaze is a married nurse and has 4 children. Okay, it's kind of of relevance. You've got to be careful though, because not every time the marital status or number of children or job, etc., is important or relevant. You can include it unless it's directly relevant. I probably wouldn't. Regarding a past medical history, she underwent a lumpectomy 5 years ago for a lump in the right breast. Additionally, a mammogram was also performed 2 years ago in husband pregnancy. Family history note for breast cancer with her sister. Okay, that's good. Mrs. Kaze presented with a lump in the left breast, which was almond in shape. On examination, the lump was 2 times 2 centimeters in size. I try and use words instead of numbers. Hard inconsistency with now. It's either an ill-defined margin or ill-defined margins. It doesn't really matter what. Make it an ill-defined margin. In addition, her auxiliary lymph nodes were palpable. Can we even have that? I thought it was palpable, not palpable. However, no nipple discharge and tenderness was noticed 2 weeks later. Patient came with an ultrasound report. What? She came to you with an ultrasound report which she'd done herself? Don't think so. So that needs to be reworked, because how that reads is that she came with the ultrasound report in her hand. Hey, doctor, look at my ultrasound report. And obviously she did not. Which showed a nodule. You can count it. You need an article for it. At the left breast, or in the left breast, on the left breast. I don't know if we would use at as a preposition of place. Apart from that, an area of highly suspicious malignancy. Right, so it's either an area highly suspicious of or an area of highly suspicious malignancy. I think it's probably an area highly suspicious of malignancy at the left breast, along with multiple nodules at the axilla, also detected on a mammogram. Subsequently, we counseled the patient regarding different options of treatment. The combination was also arranged to confirm a diagnosis. Okay. On today's consultation, the biopsy result revealed moderately differentiated invasive ductal. Well, if it's carcinoma, then if you can count it, you need an article. A moderately differentiated invasive ductal carcinoma of the left breast. Requested me to be operated by you. The patient requested to be operated on by you, as you had operated on her sister before. In view of the above, I'll be grateful if you could to manage the patient urgently. Now, I would have put urgent. Now, I remember these case notes, yeah. You need to, if it's an emergency, urgent, that needs to be in the reason for writing. So I'm writing to urgently refer for your urgent assessment. So if it's urgent, that's got to be right in the start, okay? Okay, good. Right, not so bad. Now, I've got 1 minute 42 left. Haven't got time for these. So, yeah, 1 minute left. Haven't got time. So, not too bad. We've done a lot. We've looked at, well, I've looked at 6, and I think that's enough. So, I don't really have time for questions either. I've got a minute left. So what I'll do, I'll go back to the group. If anybody's got any questions, you can ask them there, and I'll put this video on YouTube, and I'll put the link in the group as soon as that is loaded. It might take a little while, 10 minutes or so, but I'll put that up. So I think, was it 6? 1, 2, 3, 4, 5, 6. Yeah, and we've got 1, 2, 3, 4 left. So 10's a little bit many. 5 is probably all I'm going to have time for in future, because Zoom is 40 minutes. It's a free version, because I'm not paying $14 a month for the pro version if nobody's sending me any cash. So 40 minutes, that's what we will have. So I'm going to stop this share, and I'll be in the group if you've got any questions, and I'll post this video as soon as I get the chance. Right, I'll see you then.